None of the clinic's accomplishments could be achieved if not for the community's support. From hospital services and volunteer subspecialists to nursing students and front office support, the clinic relies on this unique infrastructure to keep overhead expenses low and patient care very high.
These were patients that we were already taking care of, one way or another, oftentimes through the emergency department, sometimes appropriately so and sometimes unnecessarily so, but by and large, we were already taking care of this group of patients. And so this was an opportunity. This was an opportunity to try something new and to give these individuals what today we would call a medical home.
Another factor I think that was always on our minds was how we would engage the medical community, how we would get the physicians, the nurses, and whoever to help support this. And I didn't think we worried about that because the physicians in the community are also interested and desirous of giving back to the community. So I think the concept was one that was universally acceptable and actually desirable.
Probably what sticks out more importantly is the physicians who come to the clinic and donate time. Everybody comes and says, this is what I got into medicine for. I'm giving the care that I've been trained to give, and it's been a pleasure for me to do so.
Both hospitals have been involved from the inception, and I am so proud of my hometown because both hospitals continue to see our patients for free. They provide an incredible number of services for our patients without really batting much of an eye, even though the volume and again the complexity and the costs of what our patients are needing has significantly grown.
They need continuity of care. We hope to provide that by having a constant stream of doctors coming in, volunteering their time. The reason we do it is because it's the thing to do. Folks need help. We went into medicine to help people, and hopefully we're making a difference in people's lives and helping at a time when they need it the most.
Going in to see a patient, whether it's for blood pressure or infection, you can go to the in-house dispensary and pick up medications, both branded, which the drug companies donate, and meds that you have huge samples of, and dispense those, give them little packets on their way out, and they don't have to go to the pharmacy. I love volunteering at the clinic. I get out of it a sense of helping. You know, some days, again at Medical Hills, you get bogged down in the paperwork, the drug denials, the referral denials, and that the patient care sometimes gets a little bit lost. But at the clinic, it's just purely talking with the patients, helping meet their needs, answering questions, and a very pure doctor-patient experience.
Well, usually the patients I see at the clinic are kind of the difficult people that aren't able to get back to work, and there's a problem that they can't that's orthopedically related. An example might be that a young kid has a torn piece of cartilage in his knee and it's trapped in the knee, and there's no therapy that's going to help that. The only thing that's going to help that is to arthroscope the knee and clean that out. Or the lady who has the trigger thumb, and she's working in the bakery and it hurts every time she moves that, and it's really disabling, but it's a very simple operation that you can do on it and markedly help them. And if I'm able to get that person back to work, there's a huge reward out of it. You know, I enjoy the caring and I enjoy the commitment, but I just enjoy the people, and I really enjoy that person that I'm able to get back to work and says thank you.
I think one of the best things the clinic has done is to assign the patients from the clinic to one of the hospitals on a permanent basis, because that's developing. I think healthcare is about having relationships and ongoing, continuing relationships, and having that type of relationships with those patient populations. We're going to be able to work as partners with the clinic and do true health care and preventative health.
My experience with the community clinic patients has always been, for the vast majority, that they're really nice people. You know, they may just be in an unfortunate circumstance at this point in their life. Some of them have, you know, gone back to work full time and acquired insurances, and it's just always nice to be able to give back, because you always do receive more in terms of satisfaction and just a feeling of really participating in the community as a whole.
You know, in my position now, I get to work and talk to a lot of people, and there are a lot of free clinics in the state, but not all of them have had the cooperation of the hospitals that we have had in this community.
For me, it's a real joy to be able to have an impact on somebody who otherwise may not be taken care of. We're all helping patients every day. Some of our patients, like some of the community care patients, it's easier to see the improvements that you're able to help.